remember, when we open up a sterile field, the outside of the box isn't sterile. Obviously, we can handle that. It's the inside of this wrapper that we have to be concerned with. Remember, always the outer 1 inch is always considered contaminated. Okay, so you can handle the outer 1 inch of this, and it'll want to unfold, okay, like this. And some people slowly unfold it, and then they'll do that, and then they try to stretch this out, and it just makes things want to fold in, and then they'll stretch this out, and it makes things want to fold in. Do it like this. Kind of pull it tight. Then you can rotate it a little bit. Pull this one down. Pull it tight. Rotate it a little bit. Pull this one down. Make it tight. And if you want to rotate it again to get this one. Now I've got everything laying flat. I can handle this outer 1 inch. And I'm going to slide this kind of over this way, because there's my gloves. And I have to reach in here without contaminating anything and get my gloves out. So you just pinch them up just like that. Then I've got the end of the table here that I can use to put my gloves on. Typically the gloves that come in a Foley kit are medium. I can generally squeeze my hand into mediums. I like larges, but I generally just go with whatever the kit provides. Okay? So the first step is to sterile glove. That could cause me a problem there, the heel of my hand, because of the way I do a Foley. But I'm going to try to make do. If you tear your gloves on checkoff, or if you're putting in a real Foley and you happen to tear your gloves, what do? You get you a new pair, right? Yeah. Okay. So now I'm going to try to kind of pull this down, maybe. Be careful not to touch my skin. Get my fingers up in there just a little bit better, and I tore it in. So that's the end of that deal. And I don't have to worry about.
There's some over here.
Where?
Just grabbing them.
If you want to, if you've got big hands, and just carry a large pair with you. It's typically medium size. They go medium because most of the people that open these are females, women. Most nurses are women. So they don't put smalls in there because some nurses are men, so they try to just kind of split the difference. And I know I told you this on checkoff. Once you get the glove on, don't mess with the cuffs trying to smooth everything out. Just leave it like it is. You're not going to be using that part anyway. Okay. So now I got my gloves on. This is still sterile. If I want to get this out of the way, I can. Just drop it. Notice I didn't lower my hands below my waist. There are drapes in here, and you're free to handle stuff because everything's sterile. Okay, so the shiny side always goes down. This goes up to the patient. To kind of protect your hands, just take your thumbs, put the corners in between your thumbs, and roll your hands a little bit, and just kind of tuck it. You don't have to get it way up under there, because if you go to try to get it too good, you're going to contaminate your hands on the patient. I always use this blue one too. I like a big sterile field. And I just do a little airplane motion here and drop it into place. Like that. Professor Belt likes to use, this is called a fenestrated drape. I don't use it, so I'm not going to. But again, the shiny side goes down, and if you want to cover the genitalia with the fenestrated drape, you can. I don't use it because it just gets in my way. So I always discard.
Will she want us to use that? And
you don't have to.
Okay.
The way as long as you do it the way I'm doing it, but just be prepared. She's going to tell you. I like to use fenestrated drape, but here we go, and this is how you do it. She's going to teach you. It's okay. It's okay. We all have our own thing. There's nothing wrong. Okay. So if she does that, it's perfectly fine. Now I've still got a sterile field here. I've got the outer inch that I have to be concerned with. And this box is kind of sideways on here, so what I'm going to do is I got to prepare my kit, okay? There are things that I have to do. So I'm going to pick this up and make sure that I don't set it closer than 1 inch, and now I can open it up. See that? Because one of the things I have to do, the Foley comes with this protective sheath on it. Well, I need that off of there, okay? And throw it in the trash, okay? The next thing that the Foley kit has is a syringe. And it has 10 cc's of sterile water or saline in it, okay? So you just pull the cap off. You can set this to the side, do whatever you want. You pull your Foley up and you got this deal right here. And this hooks into it. And you just push it in and twist it a little bit. You want it to be kind of snug. This isn't part of the checkoff, okay, per se. I'm just showing you what goes on when you inflate a Foley. The manufacturer of Foleys, used to in the old days, the nurses always inflated the balloon to make sure that the balloon didn't leak. Well, what they've done is, because all the UTIs and everything, they say by doing that, whenever you deflate it, it puts little ridges right here. Those ridges can cause micro abrasions in the urethra, which is an opening in the skin and can lead to UTI. So they don't recommend pre-inflating. But I'm going to show you, because when you put this in, you have to put it in until you see urine. On women, it's just going to go in 3 or 4 inches and you'll see urine. Men, I think the book says 6 or 7 inches, but it's not uncommon to have to go all the way to the Y. This is called the Y. You have to go all the way to the Y before you see urine. And what happens is when you put this in, as soon as you see urine, you need to push it in a little further, because you see there's the hole for the urine and the balloon's behind that. So you have to be able to push it in far enough to where you can inflate the balloon where the Foley can't come back out. If you don't push it, if you just see urine and try to inflate it, the pubic bone stuff's going to be in the way. You're going to go to inflate it. The patient may express discomfort or whatever. So you always, as soon as you see urine, push it in another inch or so, and you're good to go. Okay, so now I've got this prepared, ready to go. I'm going to coil it back up in here kind of carefully in my box. And now I've got this stuff that I can prepare. And I'm just going to, you've got 2 different cleaners in here. Okay, this is a hydrogen peroxide based cleaner. This is betadine cleaner. So you would ask the patient, are you allergic to shellfish or iodine? They say no, you're good to go to use betadine. This is what 99.9% of the people use to clean the patient with. If they are allergic, then you have this option, okay? So you can just set that aside. Notice I'm just dropping it, I'm not getting my hands down. And you would open this up and pour it over your cotton balls, okay? So you get your cotton balls nice and wet. Then you've got this deal right here. This is KY jelly, okay? And you also have a label that you can put on your sample cup in there if you need to. You just tear the KY jelly, and you've got this little spot right here. Just put your glob of KY jelly right there, somewhere in this, anywhere on the tray you want, really. I always put it off to the side, okay? Now I'm ready to put my Foley in. I pick my box up, and I got my sterile field. Now remember, you can never turn your back on a sterile field. My back hasn't been turned. The whole time I'm paying attention to the patient out of the corner of my eye, making sure they don't contaminate the sterile field too, okay? So this patient hasn't contaminated the sterile field. I've got everything ready, and I just set this down here. Now I'm about to have a contaminated hand. This hand here is going to be contaminated. Once you get hold of the genitals with this hand, that's where your hand stays. You don't take your hand off the genitals, okay? I'll show you how to clean a guy in a few minutes, but women are typically the most difficult to put Foleys in. And the reason being, it's hard to see the meatus in some women, okay? Guys, it's easy to see. It's right at the tip of the penis, you know, where they pee out. So that's called the meatus. On women, it's not as easy to see sometimes. Anatomically, you just have to know where it's at. If you look from top to bottom, you'll have, like, you can see right there is kind of supposed to be the clitoris, I guess, and then below would be the vagina. The meatus is going to be somewhere in between the clitoris and the vagina, okay? So that's where you go to look. So those are your landmarks. So what you do is get this deal here, and most places don't use this anymore because you can cause abrasions on the patient with this. You know, that's a pretty tender area. they use actually pre-saturated swabs. There'll come 3 swabs in that pack instead of the fluid, but this is what we use. So these are already been saturated, so you want to pick a cotton ball up, and when you get ready, there's 2 ways of doing this. You have to spread the labia apart. There's this, I think it's called like the C technique or something. Doesn't work for me. I use these 2 fingers. So what I do, and this, it's harder on the mannequin than in some ways than it is on a real person, because the labia just aren't real stiff, you know what I mean, in real life. And here, this is pretty stiff. So you're going to see, but and your hand's going to get tired holding this. Well, let me tell you, on a real person, a real woman, your hand's going to get tired too, because you'll open everything up and you'll go to clean. Well, what's that? That particular kind of tissue is made to be really slippery when wet. So we're about to wet it with betadine. It gets slippery, so that your hand's going to get tired trying to keep everything from not slipping away. So either way, it's hard. Okay. So we're probably going to do checkoffs on females, but we'll show you how to do the male. So I do 2 fingers. Spread it apart, the labia apart like that. You can rest your hand on the pubic bone, which is what I do a lot of times, or not, whatever. You clean down one side, okay? Careful not to cross your sterile field with this dirty thing, and you can drop it in the bag. Pick you up another one, go down the other side, and do the same thing. Drop it in the bag, and then pick up another one, go right down the middle. We're done. Drop the whole thing in the bag, get that out of the way. Now I'm ready to put my catheter in. So before actually, let me back up. I'm going to set that right there. Dip my catheter right there. There's different ways of doing this. I coil the catheter up in my fist. The reason being, I got a sterile hand, a sterile catheter, it's protected in my hand. It's not going to flop around and risk getting contaminated. So you find the meatus and you push the catheter tip in, which it's not wanting to go. You have to be careful not to contaminate your hand when you're doing this. So I just kind of contaminated. Let me just hit pause for a second. Let me see what's going on. All right, so I'm going to put this in.
There's a hole there. Okay.
You can see instructors have troubles too. Anything will go. The catheter is actually too big for the hole, which isn't good. So it's a good thing I'm finding that out now.
Is that a female?
No.
Putting it too far. Let me try it this way.
So we might be testing.
Okay, there we go. All right, so now it's going
barely
in.
spread it.
Be careful. You have to. You can't. It's just like putting the NG tube in. You can't go very far. You have to just inch your way in, and be careful not to contaminate your hand, because if you contaminate your hand, you're going to contaminate the Foley that's in your hand. So I've got it in. I'm seeing urine. What you'll do is you'll see urine come up in the clear tubing there. Okay. So the book tells you to then grab it like this and hold it and try to inflate the balloon. I don't like that technique for one reason. You go to inflate the balloon, and let's say it's not in far enough. The patient has discomfort. You're going to have to push it in further. Well, I've got a contaminated hand on this Foley, so I'm going to be putting a cootie-ized hand.
Yes.
So what I do is I've got it wrapped up in my hand. I get it right there, and I'm just careful to hold it in place, and I reach around behind my hand and inflate the balloon like that. Now I can let go. The catheter's not going to come out. You have to be careful. If you let your hand off of the plunger, it's going to want to reinflate back the balloon. It's going to the water will come back like that. You have to hold your hand on the plunger, just turn it a little bit, and it'll come right loose. Okay. Then the catheter goes up over the leg, like so, and you hang it on the bed frame. Some hospitals will have a little adhesive connector that will get on their leg, and it's got a plastic deal that'll flip over there and clamp this into place, okay? We use tape. So what you're gonna have to do is tape it at the Y, tape it right there to their leg, okay? So have a piece of tape ready, which I don't. Then you're gonna just hook this to the bed frame, not the side rail, not anything else. You want it to the bed frame, which is right there, okay? Some people, after they get it in, they kind of pull it back to get that balloon right up against the inside of the wall there. You can do that if you want. Tape it to the leg. So you got urine flowing, the bag's going there. Now, if the doctor ordered a urine sample, you have a cup here. To get a urine sample, if you put the Foley in right away, you can go ahead and just take it out of the bag. Let me show you how that works. The bag, this just pulls out. Well, pulls out here, just like so, and then you got a valve. Let the urine go into the cup, turn the valve off, and then put it right back up in there, okay? But let's say that the Foley's been in the patient for a day, and the doctor's wanting a urine sample. We can't take it out of the bag because we don't know how long that urine's been in there. So this is where you would take it. This is the access point, okay? But in order to do it, you have to clamp the Foley. So in order to clamp the Foley, you simply bend it like this. This is your clamp. It just fits right over the top, okay? Then you would wipe this with alcohol, take a needle and a syringe, stick it in there, and aspirate the urine out, okay? Everybody see that? The big thing to do is to remember is not to forget to unclamp it when you're done and make sure that urine's flowing in there again, okay? So I had a lot of problems getting that in, which in real life you could do that, but on a mannequin we shouldn't have that. So we're gonna look, I'll look and see if we got other female parts, but there's no way that should have been that much trouble to put that in. Any questions about putting the Foley in? Okay. All right. Be careful about contaminating anything, okay? Whoever's watching you is going to be paying attention. And what you guys need to be doing when you're watching each other is pay attention. Look for contamination. If they're putting the thing here and they brush the back of their hand against the leg, they're contaminated. They got to, you know, and if they don't catch it, you need to stop them, okay? Because they're going to fail the checkoff. So be really, really picky with each other. It's not social time and you're just watching them go through the motions of putting the Foley in. You want to make sure that you're all are doing it correctly. What I found is that those that you're practicing perfectly are sliding, just pacing right through these checkoffs. That's what we want, but we need everybody doing that, okay? Okay, so to remove the Foley, all you have to have is a syringe. I know I put 10 milliliters of water in, so I should be getting about 10 milliliters of water back out. I'll just pull it, and it's right about the 10, okay? What I do is I tell the patient to take 3 deep breaths, and I'll go 1, then I'll take a deep breath, and then I have my hand like kind of circled around this. If you just pull it out, it's going to flop and you'll get urine in your face. So I have my hand circled around it. I'll tell them 1, they take a deep breath, and then I tell them 2, they take a deep breath, and that's when I pull it out on 2. But they'll be tensing up on 3, so I take it out early. I got my hand around the tip there so it doesn't slap me in the face. Yeah, it works. I got my hand around the tip, so trust me, I'm telling you from experience, there was one time that I pulled a Foley out of a woman, and I missed it, and it flopped, and I went, oh, crap. So it'll happen to you, okay? So anyway, that's how you do it.
Full PPE, trying to protect other people.
Let me show you you have two different checkoffs in there, one for a male and one for a female. We'll just look at the male. Just spread the legs, make yourself as much room as possible. Okay, so this guy, you can see the meatus. There shouldn't, you could drive a truck through there. Shouldn't be any problem getting your Foley in. And if that continues to be a problem, we'll do it on males, because that was hard for me to get that in. So you just grab, and remember, if he's not been circumcised, you have to pull the foreskin back. Okay, and sometimes that can be a challenge, but you get the foreskin pulled back, you still wipe 3 times, but you start here, so you wipe around in a circle that way, right around the meatus once, then just make it a little wider, throw it away, and then a little wider, and throw it away. And then hang on, keep a hold of what you got, and put your catheter in, okay? Just like you would a female. Just remember, it has to go further in a guy. And you're looking at anatomy, you can kind of tell why, that it takes longer, more distance, 6-7 inches before you get urine. Once you get urine, you'll just say, I've got urine, and then you're going to push it in a little further. And like I said, I like to hold it with this hand and reach around and grab my syringe here. The book shows doing it like this, but if you, like I said, if you have to push it in further, you've got a contaminated part of the Foley.
I have a question. So what happens if, like, when you're using that contaminated hand and you go to push it in, but like something goes wrong and you need to go in further, even so?
Okay, so let's say that I've got it and I'm holding it right here so it doesn't slide out, because the body's going to want to push it out. Okay, so that's why I'm holding it here. And I reach around and he expresses, or he says I'm uncomfortable, then I'm just going to make sure that the thing deflates again, and I'm going to just reach around here and push it in another inch or so. Now, I will tell you on men, whenever, for real life, for this guy you won't have to do it, but putting the Foley in a flaccid penis can be quite an issue. Putting it in, and then because it wants to push it right back out, so you can actually feel the Foley going in between your fingers here if you're holding on to the guy. So I actually push it in, and I kind of squeeze down a little bit on him while I'm backing my hand up a little bit. And I push it in, squeeze down, push it in, squeeze down, push it in, squeeze down. Keeps it from backing out. So, I mean, that's not something you learn in nursing school. It's just like I was in the ER probably early on in my career and tried to put it in. It's like this thing's wanting to back out, so I just clamped down on the guy and kept it from backing out. You don't have to clamp down hard, but like I said, you can feel the Foley going between your fingers. You can feel it going in, okay? So you just clamp down just a little bit. So practice on that one. I don't know that I have a first one. Those are small. I need to find a I can't see.
Open your eyes.
Create a sterile field for this as well. Okay. But the first thing you do is you take, this is a combination clean and sterile technique. The first thing you do is take the old dressing off. So you got to have clean gloves on. Again, you identify yourself as the patient, your nurse, make sure they are who they're supposed to be, and I'm here to change your dressing. Okay? So you may or may not know what the wound looks like, depending on if you've seen it before, but the key to taking dressings off is you always pull the tape toward the wound. Well, we know the wound's here in the middle somewhere, so you always want to pull the tape to the wound. Just take it loose. This is sticking good. It's been on there since last year.
On both sides.
Sorry?
Report the wound on both sides.
Yes. Because most wounds aren't going to be wide open like this. Isn't even really a wound. We just kind of simulate that it's a wound.
Yeah, it's a wound.
Yeah. Most wounds aren't like this, but if you pull away from the wound, you pull one side open. We don't want to do that. You always take the tape off toward the wound. Okay, anytime we're dealing with the dressing, there are things that we're concerned with. What kind of drainage they have, if any. What color is how much, so we're worried about how much. Has it saturated through, or we're going to find some drainage on the inside, whatever. So you're always paying attention to that. What color is it? Okay, serous is like the clear fluid drainage that you get, okay? Sanguinous is blood. Serosanguinous is a mixture of the two, and purulent is green, pus, okay? So you're always concerned. So you kind of grab this in the middle, and you haven't touched the wound bed, okay? So I'm going to look at this and say, what kind of drainage do I have? And I don't have to stick my face right up in it, but I'm going to notice if there's any odor to it as well, which could indicate infection. So I could say that there's scant amount of drainage on here, which means very little, or I could say there's moderate, it's a medium amount, or copious is a lot. It's saturated through or whatever. So I've got the dressing off. You fold the dressing up in your glove, like so. Fold that up, like so, and throw it in the trash, okay? Which I don't have a
I don't
trash
have one
can.
over here either.
Okay. So now that you've got it open, again, you want your sterile field, or you want your work area to be adjusted to you. So I'm gonna raise him up a little bit.
So that part we just do with the clean technique?
Yeah.
Okay.
Okay. And this is, thank you. It's all partially, some of it we're going to be doing is a mixture of clean and sterile, and I'll show you. Okay, so I've got myself a pair of sterile gloves here. I've got an ABD pad, and I've got 2 tubs of 4x4s. I don't know, do you guys have tubs in your thing?
Mm-hmm.
Okay. There's a couple ways you can do it. You can do it with these or this. I like this, and I'll show you why. One of the things that a lot of nurses will do when they go in, they'll take that off, get all steriled up, repack the dressing or the wound, and put the dressing over the top of it, and they never clean around the wound. I clean around the wound. I teach my students to clean around the wound because they've been laying there, it's been covered up, they get sweat, whatever, there's bacteria, there. So I want it to be as clean as I can possibly get it. And sterile water is good, and this is going to simulate the sterile water. So you set your sterile field up, similar to what you did before, and you can open these up in any order that you want. Anytime you open anything sterile, whether it's a package like this, or like this, you always open it away from you, like so. You can pull it really tight to where this will stay, or you can take this off all the way. A lot of students don't take it off all the way because you have to reuse everything. And then I push it to the back here. Okay, this one I'm actually going to have to open. So again, I open it away from me and set it to the back. Okay, ABD pad I'm going to need. This is not in a tub, so this takes a little bit of practice, but you can open it this way or that way. I always open it like this to kind of see which way the thing's going to fall, and then I make that my bottom. Pull it away, just like so. I want to make sure I got it full tight enough where it doesn't cover up my ABD pad, okay? And then I've got this. I'm going to set that out of the way. And I'm going to open this away from me, okay? So in here, this is all still sterile, but I can't put my sterile gloves on yet because I'm going to need to pour this liquid in there, right? This is going to be for my irrigation and also here. So I'm going to take this lid off. I'm going to pick one of these two to get wet. Okay, so I'll pick that one. Got it nice and saturated, and I'm going to leave that one dry. And I can set this here. What I do is I reach in. It doesn't really, you'll see, what I'm going to use this tub for, it doesn't really matter if I touch the inside of the tub because it's not really going to be sterile. But I reach in and grab the ring with my pinky finger and just hold it up like that, okay? And I can now take it out and set it here. This one, you're actually going to want to take all this off, okay? Now, I've got this drape in here. And it doesn't have to be sterile either. It's just going to be used to catch any liquid. So I'm going to have the patient, help the patient pick his arm up, and I'm just going to set this drape, okay? So we don't really have to worry about it being sterile because he's got a nasty arm on it, right? Mm-hmm. Okay. The next thing I'm going to do is take my lid off, and I'm going to pour plenty in here because I'm going to use it to irrigate, okay? And notice I haven't touched this syringe. I've only touched that, getting it out of there and here, okay? So that's sitting in there. The next thing I need to do is irrigate. So irrigate, you can put gloves on or not. It's best to put them on. So you need another pair of clean gloves. Grab them for me. Those are, I can maybe get those on. We'll see.
extra large.
I might be able to get